Today's webinar, we have Professor Isao Koshima. He is going to give us an all overview of lymphedema and especially the artificial intelligence used for the analysis of over 3 decades of his work on lymphedema. We have Reiko who is going to talk on the tips and tricks of ultrasound and lymphedema, and we have Hiromatsu doctor from Hiroshima, and he will tell us about the first ever lymphovenous anastomosis, which was done in USA, and he was part of it. We will take all the questions and answers after each presentation. Today we start with Reiko. I just want to introduce brief about her. She is a consultant plastic surgeon in Tokyo. She works at National Cancer Center of Global Medicine, and she has been trained under none other than Professor Koshima, where she learned about super microsurgery. She worked with Dr. Takumi since then, and her interest is lymphedema surgery, hand replants, and breast reconstruction. She is one of the top leading woman super microsurgeon in Japan and has been invited in various forums, and she has been invited speakers in globally and has 25 publications to her name in various journals. I invite Reiko for her presentation. Over to you, Reiko.
Thank you very much for your introduce. Today, I want to talk about ultrasound for LVA using high frequency 80 megahertz because I also feel a detection of lymphatic vessel using 80 megahertz high frequency ultrasound is very difficult. So I want to share how we detect how we use high frequency ultrasound for LVA. There are two types of ultrasound to detect lymphatic vessel. One is high frequency ultrasound, and another is ultra high frequency ultrasound. High frequency ultrasound has 80 megahertz probe, and it costs 30,000. But ultra high frequency ultrasound is very expensive, $150,000. So even our hospital can't allow us to buy ultra high frequency ultrasound. So we don't have a chance to use the ultra high frequency ultrasound. But we are thinking high frequency ultrasound is also useful to detect lymphatic vessel. So in 2015, Dr. Hayashi published the ultrasound visualization of the lymphatic vessels in the healthy lymphatic vessel using 15 probe. He describes lymphatic vessel is homogeneous, hypoechoic and specular misshapen image, and no bright echoic texture around. The nerve is hypoechoic fascicle with oval shape, and the vein is round hypoechoic color in Doppler mode. But this is healthy lymphatic vessel. I think affected lymphatic vessel is different from these findings. When you want to see the lymphatic vessel and the high frequency ultrasound, First, please find the superficial fascia. And under superficial fascia, you can see the big lymphatic vessel, collector lymphatic vessel. Immediately after, under superficial fascia and deep layer of subcutaneous fat. When you want to good sizable vein is in a superficial layer of subcutaneous fat. But I recommend please not to use the very superficial vein or recipient because it's easily compressed. So, like this, first, please detect the superficial fascia and under it, you can see the lymphatic vessel. This is the lymphatic vessel and this is vein. This is also vein. So picture of lymphatic vessels and veins in high frequency ultrasound is lymphatic vessel is often seen under superficial fascia and not easily compressed compared with vein. And the two same size lymphatic vessels run together and finally join.
Actually, அவங்க lower lip cancer இருக்கா?
Hello? Bumpy sign, you can see the bumpy sign in severe cases. Vein is colored plus positive, but not always, especially in a small vein. Vessel wall is clear compared with lymphatic vessel. And veins have a lot of branches. It branches small veins and join to large veins. And vein is easily compressed. First, I will show you the video of the ultrasound in a lower leg. This is superficial fascia and this is lymphatic vessel. Because this is vein. Lymphatic vessel is quite large, 1 millimeter, and it's round shape. And sometimes disappear, but continue. Vein joins to the other vein, other larger vein. And this is lymphatic. This is the other patient. This is lymphatic vessel. This is superficial fascia. This is vein. This is lymphatic vessel. You can see quite large lymphatic vessel, 1 millimeter. And wall is bright. Here. And it doesn't join to the vein, big vein. Always lymphatic vessel is between fat lobule. This is lymphatic vessel. This is vein. This is the superficial fascia. This is lymphatic vessel. Vein, lymphatic vessel. Finally, I compress and vein is easily compressed, but not lymphatic vessel. I will show you again. When I compress, vein is easily compressed, but not lymphatic vessel. This is a famous sign. You can see the two lymphatic vessels. Sometimes lymphatic vessels run together. Two lymphatic vessels run together. And this is superficial fascia. This is lymphatic, and there is two two lymphatic vessels run together here. Here. And join. It's a growing area. This is the longitudinal view of two lymphatic vessels here. This is transverse view. We change longitudinal view. Here. Two lymphatic vessels run together. Here and here. Here. Superficial fascia. This is two. This is almost the same. To longitudinal view. Again. To and in the growing area, there is two superficial fascia. So, advantage of high frequency ultrasound is easy to access. Larger hospitals often have this probe, and you can detect the deeper vessels, 4 centimeters deeper from skin. This advantage is highly operator demand, requires training to get used to. And it's difficult to distinguish the lymphatic vessels from veins and nerves when lymphatic vessel is smaller than 0.3. But even high-frequency ultrasound is difficult to detect smaller vessels. When you perform LVA, 0.5 millimeter larger than 0.5 millimeter lymphatic vessel shows better result compared with smaller ones. So it's no problem. So high-frequency ultrasound is easy access and cheap. But learning process is difficult, and valve detection, stenosis detection, sclerosis detection is difficult. But sometimes sclerosis evaluation you can do that. You can assess, but sometimes it looks like a nerve. When you want to assess the valve or stenosis or sclerosis, you should use ultra high frequency ultrasound. So, in conclusion, for functional LVAs, when you use ultrasound, please detect more than 0.5 millimeter lymphatic vessel under superficial fascia and detect size matched veins to lymphatic vessels located not to superficial. We believe high-frequency ultrasound is suitable to detect sizable, deeper, and functional lymphatic vessels for LVA. Thank you very much.
Thank you. Thank you very much for your presentation. It was a wonderful way to know how all surgeons, if they want to do microsurgery or super microsurgery, should get trained under ultrasound, especially high frequency ultrasound. And also important point was high frequency has 4 centimeter depth, which ultra frequency doesn't have. And you should have a matched veins to the lymphatics 0.5 millimeter. Thank you very much, Reiko. And it's open, but I would like to get the feedback from Professor Koshima first. Over to you, Koshima sir.
Yeah. It's a very, very interesting presentation. Also, she showed a very clear picture. So clearly detected the the same as the ultra high frequency ultrasound. And probably my ultrasound may be 15 megahertz, so more more low high frequency. So 18 megahertz.
Yes.
Are you using 18? 18
Yes.
megahertz.
18. Yes, maximum.
That's why. 18 is very clear compared to 15. I'm using 15. 15 is a very small, compact instrument, so a machine, that's why it's very easy to carry the one room to another room.
Oh,
Also, very small operation room. We can use easily take and use. I always use this high frequency, low frequency ultrasound. Every time, even local flap elevation and also microsurgical free flap and also lymphatics. Almost all 90% of my surgery, not only lymphatics, always use. So nowadays, this is essential. Always need. And so now I'm using this machine for lymphatic detection, maybe 9 years, and over 10,000 cases, or not 10,000, or maybe about 10,000 case I use, and I found there is a special area, proper area of rich lymphatic channel. Some area, no lymph channel, and some area, rich area exists. So that's why with this technique, we can easily only small incision, 2 centimeter incision, almost 100% we can detect lymph channel. And also speed of detection is very, very fast. Only maybe few minutes we can find the lymph channel with small incision. So that's why if you want to multiple nearly 10 anastomosis during the 2.5 hours local anesthesia, this preoperative ultrasound is essential. Without ultrasound, especially very severe case, ultrasound we can every time we can detect the lymph channel, even ICG injection study. So nowadays I gave up. Give up. I'm not doing the ICG injection study. It's pain. Patient always complain the pain, and also it's lousy. Also not so much information, but this ultrasound always give us many important information. Also, we can make multiple LVA. So that's why I also with this even low low high frequency echo system, we can detect the subdermal perforating artery. So that's why this capillary perforator subdermal nowadays could be a recipient vessel of free tissue transfer, especially small tissue transfer, vascular to lymph channel, also vascular nerve flap, or fascia flap, or mini bone flap with a short pedicle. So this subdermal pulmonary could be a very nice recipient artery. And also subdermal vein could be a drainage vein. So that's why probably in future with ultrasound, use of ultrasound, we can make a new less invasive small free tissue transfers. So we can expand free tissue transfer from conventional big flap to a small component flap, nail flap, vascular nail flap. Also mini bone, periosteal flap and such we can expand. Also adipose flap for augmentation of face and also the face area. So aesthetic augmentation using autogenous vascular tissue will be probably next to aesthetic reconstructive surgery. Anyway, thank you very much. Very, very clear. Also, nice, summarize clearly. Also, price is also very important. So this, probably in future, ultra high frequency echo system would be probably not so commercialized. Even for the reconstructive micro. At this stage, we not so useful. Ultra high frequencies not so useful. Probably future, maybe 3 or 4 years later, more small nano micro probably need this ultra high frequency. But at this stage, super micro level, probably high resolution, 15 or 18 megahertz is probably enough. This is my personal opinion. Also, nerve, you said, lymph channel cannot be differentiated from venule or nerves. So you are detecting the peripheral nerve, superficial nerve fiber. Dr. Reiko, can
Actually,
you detect the nerve fiber?
Actually, we may suspect, but we can't diagnose correctly.
Probably next
It's
step.
white looks round shape, but we can't.
White fiber.
Actually, we can't say it's sclerotic lymphatic vessel or
Or
because when it's
collagen nerve. Detection is at this stage a little bit difficult, but probably in future we can easily detect the superficial nerve fiber with the ecosystem. So this is also next step. Because now I'm proceeding pain surgery. And many patients are complaining the pain caused by the superficial nerve fiber, sensory nerve. Many times compression, local compression that causes a very severe pain. Sometimes post-operative or sometimes spontaneous compression of superficial pain occurs. So almost all these painful nerve fiber, no one doing the surgery. So stripping of these superficial nerve fiber is a very, very effective with a small incision and stripping, like barracks. Stop, completely same, but needs a microscope. And the stripping, result in pain-free. So a patient are very happy after this stripping. So, but detection of nerve fiber needs preoperative nerve mapping. So lymph mapping and perforator mapping, also nerve mapping with this high frequency system. Maybe a next big topic, pain surgery. Next topic will be this ultrasound open the pain surgery. Okay, thank you very much.
Thank you very much.
Thank you.